I'm Simon Smith. I'm an infectious diseases and general medicine physician working at Cairns Hospital. Right now we've got about 40 projects on the go looking at different infections and how they affect our community all throughout far north Queensland. We work full-time clinically and do all of our research in our spare time. And so what we really needed to do was to get some help and support from that. And so we applied for funding, and thanks to the Far North Queensland Hospital Foundation, we're awarded a significant grant that will pay for a research nurse to help us speak to people, to let them know what we're doing, get specimens if they're unwell, like things like a bit of spit or some blood tests, and also help us collect some other information about them after, of course, they've been consented and are well aware of being involved in research. One of our main goals is to try and improve the research capacity in Cairns. And so what a research nurse we envisage would be doing is working with us every day. So they'll be seeing what we're doing clinically and come up with their own ideas, but also some of the projects and research interests that we have. And then depending on the study that we do, they'd help us gather the information from patients and also talk to patients, because often what we like to do when we're bringing someone or inviting them to be involved in a clinical trial or research is to sit down and have a proper discussion with them to make sure that they're aware of everything that involves, and that takes time. And we don't want to shorten that because we're busy clinically. And so having extra support, to do that means that people are fully informed before signing up to any sort of clinical research or trials. Far North Queensland, some people are quite anxious about being involved in clinical trials and think that it's all sponsored by drug companies or people being guinea pigs for new medications. Our goal really is to look at the infections that affect the community up here. Okay, so none of our trials involve drug companies. It's all about what we think, what the community either tells us of what they need or they see as issues, or what we see as issues in patients that come into the hospital. I was in Cairns for 3 years from 2010, and then went away and completed my training in infectious diseases, and then came back as a specialist in 2015. Cairns is really unique in that we have lots of tropical infections, infections that you don't see in other parts of Australia, but we have access to some of the best healthcare facilities in the world. And so looking at tropical infections with things like new diagnostic techniques, new imaging techniques, is really interesting and honestly cannot be done in other parts of the world. Some of the infections that we see in far north Queensland are things like leptospirosis. We have the highest rate of leptospirosis in Australia. We see lots of melioidosis, which is an infection you get from the soil. We see lots of scrub typhus and Queensland tick typhus. We have lots of hepatitis B, and we see lots of pneumonia that people get from out in the community. I'd just like to thank the Far North Queensland Hospital Foundation for the very generous grant and all their support, not just with this grant, but also over the last several years that we've been in Cairns.